Welcome to All Seasons Podcast. I'm your host, LoLo, a nurse, rainbow mama, holistic health nerd, and entrepreneur. This isn't your typical podcast. Some episodes are raw and juicy conversations, and others are mindful practices that will leave you encouraged. Together, we're creating a space that bridges the gap between black and white faith and the gray of real life. We will explore all things in all seasons of life, from loss, mental health, faith, motherhood, and holistic wellness. Come as you are, my friend. Let's jump right in. Wow, you guys, today we have an incredible guest. I'm so honored to have her share a little bit more of her insight and her mission and what she's doing to change the realities for many women dealing with early miscarriage. So today I am joined by Hannah Muir. She is a certified nurse midwife based out of Georgia, and she is actually pioneering one of the very first early miscarriage care clinics in the U.S. So welcome, Hannah. We're so happy to have you.
So happy to be here. I've been so looking forward to it.
Yes. Well, my gosh, we have so much to talk about as fellow nurses, lost mamas, and being really on both sides of the coin as far as patient care, being the patient ourselves as well. Would you just kind of tell our listeners a little bit more of who you are and maybe go into your personal story of loss?
Yeah, absolutely. So I have been a midwife for close to 10 years now, and I've hopped all around the country. Was born and raised here in Georgia, so this is my home. I'm a Georgia peach at heart. And then I went to school at Vanderbilt and stayed in Nashville for a little bit. I worked in a federally qualified health center, which I loved that patient population. Feel like I got to see everything there. And then I was in Houston in a private hospital practice. And then most recently in a concierge practice here in Atlanta. So I've been able to hop around a little bit and see birth and see pregnancy and GYN care and how it looks different in different states. I've had the privilege of catching a lot of take-home babies and then also walking through pregnancy loss with lots of mamas, from the early losses up until the 40-week losses. And I do consider it a privilege to be able to walk through that with them and that journey. It's to be able to hold that space, I really consider an honor. As far as my personal story goes, I have had a loss, and I will get to that. But to lay the framework, my first pregnancy was in 2019, and it was a very traumatic pregnancy. I was a high-risk pregnancy, and I really struggled to bond in that pregnancy. And there was a grieving that took place as the pregnancy progressed. Like I knew she would be preterm. I knew I would need a C-section. There was a chance she didn't make it. And so mental health-wise, I really struggled, and I didn't seek help, which, as you know, as a nurse, is pretty common for us to not seek help. So my mental health started to deteriorate in that pregnancy. And then once she was born, I had developed postpartum anxiety, or it more so bled into that postpartum period, and OCD. Really, people didn't say anything. It was, looking back, it was really obvious to me, but especially being a midwife, I remember my husband was like, "You would have said something, right?" Like, no. So it really, my mental health journey really started in that first pregnancy. And then we conceived our second pretty unremarkably. But as many lost moms say, there was like a gut feeling in that pregnancy of this is not, like, there's something wrong. And I remember talking to my mom and just crying. And I was like, well, she still has a heartbeat now. And there was this kind of detachment from like getting my hopes up, even though there was still a heartbeat. And I had the luxury of having ultrasound in my office, whereas a lot of people don't have like the imaging or the videos. I was able to check in. And a few days before like my actual ultrasound, I was like, I'm going to stop. I'm just going to stop doing self ultrasounds. And I actually was in the hospital on call, in the call room, woke up the next morning, went to radiology, And of course it was a student and they didn't say anything and it took forever. And then when I came back up to the office, my precious partner was like, I'm so sorry, and gave me a hug. So I was about 10 weeks there, and Haven stopped growing probably 9 weeks.
Mm-hmm.
And in my mind at that time, I was like, I know it's not my fault. I want this to be over with. Like, I'm done. I don't want a DNC. Like, I just want to do the medication and just be done. And so it was prescribed that day. The side attack experience for me was very traumatic at home. And I felt at the time I was okay emotionally, but physically, even knowing what I know, and I tell people like, hey, it's going to be a lot of pain. It's going to be kind of like labor. Like some people respond really, really sensitively. Others don't. It was so traumatic for me. And I remember my poor husband I was like, I want to die. I want to die. I was asking God. I was like, please just take me.
Wow.
And then I felt so sick, like hearing, the process take place in the bathroom. He really had to do a lot for me. So that happened. I thought it was over and went back to work, which of course, mental health wise, highly don't recommend, especially if you are face to face with your triggers, like delivering babies or people with the same due date as you. And you're like, congratulations.
Oh, goodness.
So a few weeks later, developed a fever, endometritis, which is an infection in the uterus. So I had to be in the ER, had to stay for IV antibiotics and get a DNC. And still to this day, my husband was in the hospital recently, and I'm like, I can tap into that feeling going back for my DNC and how relieved I was to go under anesthesia. And I know it sounds silly, but I was like, just knock me out. And I think that resonates with a lot of people. I didn't want to feel anything anymore. And it was such a relief to be able to like check out and know that I was under general anesthesia. So that happened. Once again, I thought that was kind of the end of the road. It wasn't. My HCG wasn't going down. I had some discharge and period never came back. So they did an ultrasound. They saw vascularity. Didn't know what it was. Sent me for a CT. They thought I had an AV malformation. Luckily, I was with a system who like takes care of their own. So I was able to get in really quick over the course of these like 2 months. But saw an interventional radiologist. They were like, we're probably going to have to do a uterine artery embolization for this. So went in for that procedure. And he was like, that's not it. It's still retained products. So did a second DNC with a hyst and finally got everything out. Wow. So that process from like the side attack to needing 2 DNCs and the uterine infection, it really is as involved as it could have been for me. And I was able to really experience what all the aspects of management look like. And even looking back, I was alone for most of it. Obviously, your partner can't go back with you for certain things, but even in the ER, having that really tender uterus, I was alone crying, getting an ultrasound done. And so as the years have gone on since the loss and experiencing loss through the lens of other moms and other families, I've just realized these huge gaps that exist in care. And some of it's up here, right? Some of it is the narrative of pregnancy loss and culturally what's been passed on from generation to generation. When I ask a lot of people, what is your familiarity with loss? Most people don't have any data point of, my mom told me all about her losses, or my aunt told me this, and I know this. And really, we just don't have education until we're in it, and we have to self-educate. And I think it's such a huge disparity as a women's health provider that at our annual visits, there is not one single provider that I know of who says, hey, in case you get pregnant, here's the stats on miscarriage. This is what I would look out for. This is when you need to come back. To me, that's part of preventative care in a way. We do a great job educating once ladies are pregnant, right? On like birth things that can happen and what to look out for. but we don't do any education before it happens with pregnancy loss. And so people are scared. They don't know what to do. They may not have established with their providers yet. And so they have two options. They can either try to get in with an OB or they present to the ER, which we know over 1 million ladies present to the ER for vaginal bleeding in early pregnancy in the US. And so in creating this clinic, really I've tried to identify what are all of the gaps in miscarriage care here and how can we be a solution for all of those. So part of that is management and being able to safely and effectively treat outpatient, because really less than 2% of the time we see complications, and being able to safely manage. If there is a need for the ER, then we refer them to the ER, of course. If they're hemorrhaging, if they're infected, if they need, an IV or something beyond our scope, then we don't jeopardize safety. But being able to provide an empathetic setting, a non-triggering setting, so trauma-informed care, where we are just seeing them for their loss. They're not with postpartum moms, holding or pushing their stroller in, or a bunch of pregnant bellies, and they're not being skirted out of the ER for another bed, that we've been able to take the time and walk them through that process. So what that looks like for management is ultrasound, of course, especially with abortion laws being what they are. It's just a must. We have to confirm what's going on. And that helps guide the management as well. Labs, and then medication management, and then uterine aspiration outpatient. As far as the more holistic side, we've partnered with some doulas to offer miscarriage doula support, which is amazing.
Yeah.
And every single person has a consultation with a therapist. So I have 4 therapists who are doing free consults, basically, for every single person that comes in. And it might be you need ongoing one-on-one support. It might be you're a great candidate for a support group or another form of support. But they at least can make that initial assessment of where you are, what to expect from a grieving perspective, some things that might help, some tools that can be beneficial as well. And then they're also a point of contact for women to then follow back up with. Because another thing that I found is, even for me, I can't tell you how many people are like, hey, my sister-in-law just lost a baby. Can I give her your number? And I'm like, sure. I guarantee she will not reach out, though.
Yeah.
It is
That's
just,
so true.
Once again, when we are grieving, changes our brain. And so it's good, it's adaptive, because the goal is survival for us. But if there's anything that feels remotely unsafe or out of our comfort zone, it's just not worth it. And it's not like it's not a personal thing. It's just a physiologic adaptation to the grieving process. So in order to be able to have that like touch point with a therapist early, to develop that rapport, and actually I think all of them but one have had a loss themselves too, and are focused on, perinatal health, mental health. It gives you that credibility from the start, and you already have them in your phone to reach out to.
Yeah.
That's
so
a
beautiful.
long version of my story. And then the inception of the clinic, just purely based off of observation and personal experience. And we are just long overdue for someone to step up and say, hey, this is too common and too prevalent to not be providing specialized care.
Amen. Yeah. It's really crazy. It's really that only blind spot, or one of many blind spots, but a huge blind spot in the US health system. It is this huge prevalency, right? And we all probably know someone who has dealt with pregnancy loss at some point. And yet it's this like awkward thing that still is very much, like you're mentioning, very much shrouded in shame and silence. So if you could say something to the listeners right now who are maybe currently experiencing miscarriage, or no one's spoken to them about the prevalency or what to expect. It could be a medical kind of lens that you speak from right now, or maybe just from the heart. But what is something that a little nugget you would share with them, just to kind of bring them the comfort maybe that they need right now?
Yeah, absolutely. First and foremost, you are not alone. I think that just needs to be resounding. You are not alone.
Mm-hmm.
Even if you have the world's best support system, the world's best siblings, there is a tendency towards isolation.
Mm-hmm.
And we as humans need community, and we need people to surround us in a non-judgmental way,
Yep.
and who have been through it before. We always use be her village, as kind of a slang, and we've gone far from that, but there's so much truth to that. And women who have been through it before supporting other women who are currently going through it. So you have to know
Mm-hmm.
that you're not alone. I can't just give one nugget, Lolo. I'm
I
sorry.
know it's so hard.
And then also, there is nothing that you could have done to cause this.
Mm.
I think you have to know that.
Mm-hmm.
I can't tell you how many people start a conversation with like, hey, last week I was so stressed. And before they finish, I'm like, I'm going to interrupt you. There is
Mm.
no amount of stress that could have caused your loss here. Like, there are a lot of
Yeah.
things that, we test for and could have been the
Mm-hmm.
reason, but there's nothing that you physically could have done to
Mm-hmm.
cause it.
Yeah, that's so good that you touched on that. There's so much misinformation out there, or even just
Yeah.
misbelief around it when, like you're saying, there's really not a lot of education on the front end. So really we're just left to our own devices to wonder. And it's crazy how many women just feel some
Mm-hmm.
sense of shame or secrecy,
Oh, yeah.
after a loss. And just really, it's that all overwhelming question of, did I do something to cause this,
Mm-hmm.
or did I not do something to cause it? Was it that prenatal pill that I missed?
Right. Right.
Was it that run that I went on? So hopefully there's somebody here who listening who just needed to hear that little nugget today.
Absolutely.
So when you are looking at, when are you guys going to open, by the way? I'm
When
curious.
we get the funding, we will open. So my
Wonderful.
goal,
Okay.
my goal is the fall. Of course, I've already told you I'm terrible at setting boundaries. We're gonna just like lay out all of my flaws here. I am obsessed with quality. I will not open something unless it is going to have, as far
Mm,
as quality, there's just too much at stake to open too soon and not be able to offer all of the things and the services that we want to. So I'm trying to be really intentional about timing of
mhm,
opening, and then of course be a good steward and have the funds there too. So I'd love to have opened yesterday slash
mm.
3 years ago, 10 years ago,
Sure. Yeah.
because there is always someone I come in contact with that I'm like, I want this for you. I want this to be
Yes.
open specifically for you.
Hmm.
So
Always.
we are
Yeah.
working hard and desperate to. I don't
Hmm.
have an actual date, but as soon as we possibly can, because the need is so there.
It's so great. And just to kind of bring it back to what you were talking about, it's really true in this, in our US health system currently, when a woman has or experiencing vaginal bleeding, they're expectant that they're having some type of a, early term loss. Really,
Mm-hmm.
their OB office is really difficult to get a hold of. They can't really get
Right.
in same day. So, like you said, they really end up sitting in ERs,
Mm-hmm.
which I've been on that side where as an
Yeah.
ER nurse, and it is not a very empathetic environment to be in.
Right.
It's a very like cold and clinical approach.
Right.
There's really no resources or follow up. There's not even really rites of passage to be given. Hannah, like
Mm-mm.
we've at a Soulful Star, we're really passionate about empowering women when we go through
Right.
this transformational experience, right? We've had
Yeah.
experienced life and death now in our womb.
Mm-hmm.
And it's a huge rite of passage. And with any other type of loss that we experience or endure in life, there's always, meaning making to draw from these rites of passages and
Mm-hmm.
ceremony and things like that. And there's just no like wraparound services or even
No.
conversation around
No.
that. No advocacy for mental health. So
Right.
in your clinic, I love the fact that you guys are making quick introductions to therapists. So, for people who are listening who are not in Georgia, who cannot get over to your early miscarriage clinic but are in need, what are some practical options for people to advocate for their needs who are basically anywhere else in the country? Let's say
Yeah.
they do go to the ER and they have a not so great experience. What are some practical things that they can maybe come back to their OB or do or
Sure.
seek out for themselves?
It's a great question, and I don't want to sound doomy and gloomy with it at all, but advocacy is really, really hard in this arena
Mm-hmm.
because this is so multifaceted, right? It's not
Mm-hmm.
like we just broke a bone and want to get in a great cast, like cutting edge technology to heal a bone. Because our mental health, while it could have been a traumatic experience breaking our leg, it's different. We're grieving a loss. And
Mm-hmm.
so, once again, back to that preservation mode of survival, um, it disrupts our reasoning and our
Mm-hmm.
executive function. And there's people who, as they're processing, are like, why didn't I say anything? And
Mm-hmm.
why didn't I do this or that? And first off, have grace with yourself. You can't help it. That's our body's
Mm-hmm.
protective way. And we kick into that sympathetic nervous system. It really, like, we can't even make a decision. So while I would love to say advocate for yourself, bring this latest research on what is the difference between uterine aspiration and DNC and which of your providers do this, it's a really hard ask for someone
Mm-hmm.
who has just found out that they've lost their baby and really is just floundering and surviving.
Mm-hmm.
So have grace, but also have people in your corner. So whether that's a partner, whether that's a sister,
Mm-hmm.
someone who's been through it, in a really safe, private setting, do some research, talk to them about your
Mm-hmm.
wishes. There are so many options that are never, ever offered to women. Um, Once again, can't tell you how many times I'm talking to someone who lost a baby years ago. Yesterday, never was offered genetic testing, never
Mm-hmm.
was offered any follow up to do just a basic panel to make sure something easily treatable, like a thyroid, wasn't checked,
Mm-hmm.
and didn't know that was an option. I talked to a mom last week who was like, I wish someone had told me if I could have my baby. Once they took it, she's like, I obviously, like, no, I probably couldn't see it, but like, could it have been cremated? Could I have taken it
Mm-hmm.
home? And that's something that is possible. So
Absolutely. Yeah.
have a discussion with people you feel safe and comfortable with in a private setting. Considering my loss, this is what's important to me.
Mm-hmm.
This would be my preference, to really just
Mm-hmm.
sit in the grief for a little bit and wait and
Yeah.
not make a decision for a while and not feel pressured, and then move past that. And so once you've figured all of that out, let
Mm-hmm.
someone be your voice for you.
I love that.
Whether it's a partner, whether it's your mom,
Mm-hmm.
once you've made, some headway with what best of
Mm-hmm.
the worst, I always say, is, let them speak for you and be your advocate. So it's not as much
Mm-hmm.
self-advocacy as it is having someone be the voice for you. And
Mm-hmm.
then if you're not getting answers, then find someone who is going to give you answers.
Mm-hmm.
Because like
Yeah.
we spoke earlier, Lolo, with grasping at a reason this happened, when we are not given
Mm-hmm.
answers, we naturally fill
Mm-hmm.
that with something, even if it's
Yeah.
outlandish, like
Yeah.
you were around a chemical, that was like two doors down. It's like
Mm-hmm.
something
Yep.
to fill that void. So the more answers,
Mm-hmm.
the more information, the more informed consent, it
Mm-hmm.
actually helps us mentally
Yeah.
as we embark on the loss journey.
Absolutely. I love what you mentioned about having and kind of like allocating an advocate for
Yeah.
you. And if you do find yourself in that position, you can ask questions. You do have
Yeah.
the right. Ask, like you're saying, for genetic testing, for a baby, also some lab work for you, just to make sure that things are okay and at
Yeah.
baseline. There could be something, going on,
Right.
oftentimes not. But if
Right.
there is something that can be caught and potentially corrected for next time, that's definitely something that you are in full power of being aware of. So when you're going back after a loss to an OB, another
Mm-hmm.
thing, I don't know if you saw this TikTok by an influencer recently. She's like,
Mm-hmm.
we need separate waiting rooms,
Yes.
like in OB offices. You guys, you can ask for that.
Right.
You can
Or
be that
asked to go
person.
straight back.
Ask to go
Yep.
straight back.
Yep.
You can wait in your car. They sure probably have an empty treatment room you can go straight back to. Just
Absolutely.
little simple things to help kind of advocate
That's a
for
great
yourself.
point.
Yeah. And then kind of some practical tips of like green flags when you're looking for an OB. And I'm speaking from real personal experience where with my first loss, I had a secretary tell me over the phone that my HCG levels were going down and I was probably miscarrying. And she had no right to tell me that information. And it was like earth shattering. And it was just like another Tuesday for her, right? And so I knew right then and there, okay, this office is not giving me the support that I need. And I did. I went and I found an OB that was more collaborative with me, that really sat down, was able to really hear me and allow myself to ask those questions and advocate for myself. And when we did try to conceive again, she was more open to hearing my concerns and maybe more often scanning and things like that. So there definitely are some green flags, and there are wonderful providers out there. And sometimes it's just a matter of finding those people. Because people like Hannah exist out in the world. They really do. They're rare, but you're worth finding someone who's going to hear you and walk through this with you.
And I was going to say too, sometimes time is of the essence. But if there's a specific, because I know nowadays there's practices with so many providers, and you saw one and then it's someone different the next time. So if there's a provider that you really feel like is empathetic and has like developed a really good relationship with you, then you can request to see that provider. Like, hey, what day is Dr. X in the office, or can I have a call back from this doctor? And you can request that. Inconvenience is just, it's not a thing. Like, I think it's taking care of yourself, unfortunately we do have to advocate in that sense now. But to ask for a callback, that's not something we're going to roll our eyes at, especially when you're experiencing a loss. So
absolutely,
you can ask for the provider who's been following you to give you a simple callback, to discuss your HCG or what are next steps, because sometimes we get that trending down HCG and then it's like, what do I do with this information? Like, what's going to happen next? Are they going to call me? Are they not? And we end up being the ones who have to coordinate our care, which is also not something that we need to put on women to do. But that's the hard reality of pregnancy loss, is we have to be the ones to take the initiative.
Yeah. Kind of another thought that I've heard a lot in the loss community and just from mamas who, have all these, there's so many different versions of loss. None two are the same. There's, loss at all different gestations. There's chemical pregnancies all the way to stillbirth. In your experience, personally and professionally, what would you say to the person, or maybe the belief in general, that our grief coordinates with gestation? And just because I was 5 weeks or 9 weeks or 16 weeks or whatever, at least I wasn't full term, or it doesn't matter as much. What would you say to that mom?
Loss is loss. And loss is different. So even if I have two moms who have had 8-week losses, that can look completely different. Or two moms at 37 weeks, that can look completely different. And there's a lot of factors in there. The IUFDs, or the stillbirths at term, I still remember every single baby by name that I have caught, and what they looked like. It's a different, the cries from those moms are very, very distinct. And that's hard in its own way to deliver a full-term baby. Early on is hard in a different way. Some people haven't told anyone yet, but there's still this idea of what your life's going to be like with this baby, and you've already planned your whole life with this baby. And there's a lot of shame of, did I make them live as long as they could have in that short amount of time? There's a lot of emotional turmoil with the early losses, and telling people and not telling people, and the life you've planned. And it's grieving the loss, but it's also grieving the life of what that baby would have looked like in your family, and all of the things that come with planning for a baby. So loss is loss, but it looks incredibly different. So it's not a necessarily harder, easier. It's just a different.
Yeah. Yeah. And it's still valid. Still
Totally.
valid at any gestation.
It
I love
totally
that.
is. And I will say too, with blighted ovum, just to put a touch, because you mentioned it, there used to be a lot of complex feelings with like, okay, there's not a baby. But what we know now is most of the time there actually was an embryo, and it was reabsorbed early, like to the point we couldn't detect it. So to be able to validate that, like, yes, we could only see the sac on this ultrasound, but most of the time, like, we know more now, there was some sort of embryo that did form, because people are like, if I can even say baby, I hear that a lot, like, well, it was just a sac, you know, if I don't think I can even say baby. And I'm like, you are heard and you are seen. And whatever helps you in the grieving process, you know, validate, you know, because you still were planning for a baby.
Absolutely. Yeah. You see those two pink lines and you fall in love with everything from that point forward. And so just thank you. Thank you for standing in the gap and for being an advocate for so many women who feel silenced and who feel siloed and just invisible with early loss. That's something that we're so passionate about, giving a voice and helping women. You know, it's kind of in our name, but it's been this silent sorrow, but helping it be a more soulful and meaningful experience, and one that, dare I say, could even be transformational and beautiful.
Absolutely.
So thank you for offering all these services. And so for people who are listening and who are excited for this to become reality and are cheering you on like I am, what are some practical ways that we can champion you, come alongside the clinic, and really see this through fruition?
Yeah. So do exactly what you've been doing, because you're amazing. Really, I have been so humbled by the lost community and what everyone else is doing to support women. So I am so thankful for you, LoLo. I'm so thankful for all of these other organizations, because the heartbeat of them to change the narrative of loss, to come alongside of women, support them. I think I speak for you. Like, you would do whatever it took to support someone. And I think that's overwhelmingly the response. So I think what a lot of people are already doing, keep doing. Of course, like, interactions on Instagram and social media is great. We definitely need funds. We're a nonprofit. And the reason we created it that way is because I'm sick of a system that is just trying to make money off of people, and so believe that pregnancy loss has affected so many people that people can give back. And I so believe in that. And so whether it's a one-time gift or a monthly donation, we have a not lost movement. So, you know, just because we've had a loss doesn't mean we are lost and our baby is lost. So really a way to say we are not lost. And that's our monthly giving program. And you can find that on our website, which is havenmiscarriageclinic.com. And then if you're in the Atlanta area, we are having our first big fundraising launch event. And that is on September 19th in Buckhead. And we have some more information on that through our Instagram and our social media platforms. So you can attend that event as well. So whether it's just sending up a prayer, giving financially, it is also appreciated.
Beautiful. And I'll be sure to link everything you just mentioned in our show notes, so everybody can get connected with you on social and get behind the Not Lost movement, and hopefully start raising some monthly and yearly funds that you guys are needing.
Absolutely.
So, well, thank you so much for your time today and your heart and what you're doing. We close out every episode just asking our guests, what is one truth that has remained true for you in all seasons of life?
Which is such a good question. I already told you I was very stumped, because I love a good, you know, mantra for certain seasons. It has to be just the word victory. I think in my darkest of dark moments, just to have some sort of hope that there would be victory in my life. Whether it was, my marriage falling apart at one point, or, not knowing when this lost journey was going to come to a halt. Just to say, like, there's going to be victory here. And it takes a long time for some people to see some hope because it's very bleak. But throughout my life, I think that's been something that's been a common thread for me.
I love that. That's a beautiful word. Thank you so much, Hannah.
You're welcome. Thank you
so
we'll
much
for
you
having
back.
me.
Yes.
Tomorrow. No, I'm just kidding.
Right? Thank you so much for your
You're
time.
welcome.
We're all cheering for you. You guys, try to open your doors very soon. Congratulations in advance.
Hoping and trusting it will happen soon. Thanks so much, Leslie.
Thank you for tuning in to another episode of the All Seasons podcast. I hope today's episode lit you up with inspiration and illuminated your path with clarity. If you've enjoyed today's episode, please share with a friend. And also be sure to hit subscribe and leave a review. You can stay connected with me over at Instagram at LoLo Pause or A Soulful Sorrow. May you find your soul shine in all seasons. Until next time.